Good morning, Eastbourne. Patrick here, coming live from Complete Health. And I wanted to talk about a topic that a load of people had been asking me about in the clinic over the last couple of weeks. People have got friends and family, and they were just a little bit concerned because one of the things that obviously chiropractors tend to do is a lot of movement and work on the spine. And so as a result, a lot of people have asked me, can osteoporotic patients receive chiropractic care? Now, like anything, obviously everything has to be adapted for the specific needs of that person. However, chiropractic care is suitable for those with osteoporosis. However, there's also some other factors that we have to look at where your chiropractor might actually be able to help you if you're suffering with something like osteoporosis. Now, obviously with chiropractic, it's a 5-year degree and we study through a multitude of different conditions, sicknesses, illnesses, so that we can actually spot these conditions. But part of the training to be a chiropractor, we have to understand the modalities and ways and the physiological changes inside of someone's body for these processes to take place. Now, if we understand what osteoporosis is, then we can start to understand how we manage it. Now, what we know about osteoporosis is a condition in which the bone density of our patients has been significantly dropped. So, that being said, if your bone density has become more dropped, do you think it is more likely that they are going to break or stay stable? So what we know about those people with osteoporosis is the likelihood that they're going to be slightly less stable as far as their bones are concerned, which means that we have a much higher risk of fractures. So that being said, what do we need to consider when we are working with osteoporotic patients? Well, first of all, the techniques that we're going to use. With anybody that's got osteoporosis, the likelihood is we're not going to be using the same kinds of techniques that we would be with other chiropractors. So a lot of people with osteoporosis might be a little bit scared to go and see a chiropractor because they've seen videos online of chiropractors adjusting spines and watching joints pop and click. And for those types of people, the likelihood is that this is not going to be suitable. So go speak to a chiropractor, see what techniques that they can offer for you and see if they can actually modify their plans to suit your needs. Now, what I want to do is I want to just highlight a couple of things that if you are an osteoporotic person or you know someone that is osteoporotic and that this video may add some value to them and really be able to help them, what we're going to do is we're going to go through some really simple points that you can immediately change in your life in order to ensure that you're getting the right quantities of certain things in your lifestyle in order to make sure that osteoporosis does not develop any further. So here are a few of my biggest tips to help people with osteoporosis improve on their bone density. Now, what we know about osteoporosis is it is a reduction in our body's ability to hold and absorb calcium. So what actually ends up happening is our body takes that calcium from our bones and dumps it into our bloodstream. Now, the reason why it does that is we need calcium to make other processes work. So our nerves and our muscles both require calcium as an element in order to engage muscle contraction and proper nerve firing. So if we do not have an adequate amount in our diet or our body is struggling to absorb that, there are a few things that we can start to do in order to make sure that we're getting the right things into our body. Now, one of the main things that you can do immediately in order to make sure that your bone density is increasing is you can increase on these two things, either in your diet or in your lifestyle. So the first one is vitamin D. Vitamin D is an absorbic vitamin and is actually an enzyme that allows us to absorb the calcium from our diet. Now, the other thing that you obviously want to do is not just make sure you've got the vitamin D, because the vitamin D is essentially the friend that's going to bring the calcium into the party. So essentially, if you think about, you get to the door of a club and there's a bouncer there. And the bouncer says, calcium, you can only come in if you have that special guest that's got an invite already. And vitamin D is that special guest that's got an invite, and it's going to allow your calcium to pass through the gut so that you can absorb it into your bloodstream, so you can send it around to your bones and your muscles so it can be used adequately. So you cannot get away without having the vitamin D as well. So this is why a lot of osteoporotics are prescribed by their medical doctors vitamin D. Now, you don't necessarily have to take a supplement, but you do have to make sure that you're getting an adequate supply. And I've done a previous video on this, and it is about getting out into the sun. the next point, what we really need to understand is that if we are not absorbing food properly, then the likelihood is that calcium is also going to get involved with that. So e.g., if we have a problem with our intestine and it's inflamed, the likelihood is not only calcium, but all vitamins are going to struggle and minerals are going to struggle to pass through our colon. As a result, what we have to understand is that if vitamins and minerals are struggling to come through our colon, then we have to look at other modalities of trying to get it through. Good morning, Anne. That being said, what we want to make sure is that if we're going to reduce the amount of inflammation in our gut to allow certain foods and vitamins and minerals to pass in, we need to make sure that we're eating the right food. So eating mainly natural will immediately reduce the inflammation in your gut, and it will make it much easier for you to actually absorb those vitamins and minerals. Now, osteoporotic, low bone density. What we know about low bone density is actually increased levels of resistance-based exercise will actually start to increase your bone density. Now, a really interesting statistic, if you look at a tennis player and you look at their racket hand versus their non-dominant hand, they actually have about a 30% higher bone density on the racket hand. And this is to do with the micro stresses that are going through their hands as they're hitting the ball every single time. So what we know is resistance exercise. By the way, this is not only good for those with osteoporosis, but those trying to prevent osteoporosis and those trying to maintain good joint and bone strength. So a little bit of resistance exercise is massively going to make a difference. So let me just summarize. What we already know is that we know that if we have low bone density, some of the things we need to absorb: calcium, vitamin D, resistance-based exercise, or any exercise in general, and improvements on our diet so we can actually absorb those vitamins. Now, the last two things I want to talk about is stuff like soda and caffeine. So soda has got phosphoric acid, and coffee and tea have got caffeine. If we're absorbing too much caffeine, what it will do is it will actually inhibit the absorption process. If we're drinking too much soda, again, it will draw it out. So again, we can start to reduce our bone density by the types of foods and chemicals that we put into our body. Now, the last thing you want to do is make sure you're getting the right advice. Now, this doesn't matter what health professional this comes from. It just needs to be someone from that understands the physiological processes. If someone understands the physiological processes, they can give you the right advice, whether that's via lifestyle, medications, whatever, but that will reduce that risk for you. Now, one of the other things that we know about chiropractic care is it's going to improve the balance of our patients. It works with our Parkinson's patients, our MS patients, and a lot of our patients will generally see good improvements in balance, because when you get the joints moving, the brain can start to understand that sense of awareness. And if the brain has got a better sense of awareness, we're less likely to fall. So this isn't necessarily in the treatment of osteoporosis, but it's in the prevention of fractures and breaks for those patients that have got osteoporosis. So guys, make sure you find the right advice. Make sure you find the right. Yeah, I love a good cup of tea as well. In fact, I'm a big fan of coffee, but what we've got to understand is about balance. If we are going to drink those types of things and we are going to absorb those things, what we obviously need to make sure is that we are balancing them out with the right levels of other things. So say, for example, if you had a cup of tea or coffee, you may actually need to up your calcium levels or certain vitamin levels in order to balance that out. So everything is about balance. Always about balance. Always about balance. So if you found the information helpful, guys, please like and subscribe or share this to people that you think it might be helpful with. The other things we do, we also put these videos up on YouTube. So if you ever need to refer back to them, they're available on YouTube as well. And again, if you want to see more of our videos, you can just like and subscribe on YouTube. Equally, we're going to start putting these short videos and we're going to start putting them over to our podcast so you guys can listen to them there as well. Guys, thanks for listening, and I look forward to seeing you all soon.